Matthew Holt, I'm at the HIMSS show floor for another TCB Quick Bite. This is Dr. Anil Jain. He is the Chief Innovation Officer of Innovaccer. So you're the innovation guy at a company which has got like half the innovation word in its name, for a start. All right, so Anil, tell us quickly, for those who don't know, what the hell does Innovaccer do?
Well, Innovaccer is a cloud-agnostic, EHR-agnostic data fabric that basically brings together all the data that a health system might be sitting on and aggregates it in a way so that we can help improve and help transform the way that population health proceeds. In addition to population health, we also help with transforming the way that we deal and interact with patients from a CRM point of view or a PRM point of view, or what we like to now start calling a value-based CRM point of view. So it's really around aggregating all the information that a health system is sitting on and bringing it together in a much more usable way through what we call our data activation platform.
So when I first met the company, I think you were like 5 guys and a dog in San Francisco, a bit more. Jonathan Bush had just put some money in, I think, and at that point, the cool stuff was that you were taking the data from multiple different systems and EHRs in one healthcare organization and then presenting some information around that to the clinicians. But sounds like you're doing a lot more now on the provider side. So give me a few examples of those use cases. Now I've got all the data and I've normalized it and done all this great stuff with it. What are the kinds of things that you're servicing up to whom within a healthcare system?
Well, I think one of the most profound use cases that we have is there's a lot of pressure that health systems are under to perform well in their value-based care contracts. So once you start to bring all this data together and you start to marry it with the claims data that's coming from the health plans, you can start to draw out interesting patterns and identify patients and members who may be at risk, who may need additional services in order to reduce the unnecessary total cost of care, and bring those insights to every member of the care team that needs it, whether it's the physician, whether it's the care managers and care coordinators. So in such a way, we can actually start to change, from a workflow point of view, the behaviors that all these folks may experience in order to reduce the unnecessary cost and have a preferential experience with those value-based care contracts. That's one. And the second is taking every single one of the folks and reducing the total burden that they may have under.
All right, and I also see, and you've got a bit of a screen-playing propaganda here, which is the ability to show in the ChatGPT style, looking at some ways to query the data. So we can scoop around there. This is Sarah, right? Your new tool?
Yeah, Sarah is, I would say it's
Sarah, we don't know how to pronounce the name, but we'll
call it Sarah for now, but think of this as a precursor to GPT. It literally is a conversational AI that allows for natural language query of a data set, and it allows us to ask questions in ways that we normally would naturally ask and get answers back. And although it's not using GPT, this is our sort of our first step along the way of conversational AI as we move into more complex use cases that we're working on to help reduce the burden for doctors and nurses.
So that would make some dummy like me able to query a data set that normally would be required an analyst.
That's right. You won't need to be a DBA or a data analyst who knows SQL in order to query data. That's exactly right.
All right, fantastic. So on that, we just took on the provider side so far. Give me a quick number for number of provider organizations that you guys are now contracted with. Where are you in that world?
Yeah, we have probably well over 60 healthcare system clients that are working with us on a variety of use cases, especially around the population health side of things.
And then a couple of years ago, you started branching out to payers and life sciences. I know there was Blues of Arizona involved. Where are you in that part of the business, and what kind of things are going on there?
I think we're growing in a fantastic way. As you know, it takes a community, and many of our payers want a much more clinically savvy way of looking at data, and they want us to be able to help them with not only some of their clinical data needs, but to help them bring sort of the partnership that we would have with our health systems around risk adjustment, especially around the Medicare Advantage contract. So we're doing very well with payers who are really thinking about what is next for provider engagement and clinical data.
Now, on the payer side, are you bringing them the data from your provider partners, or do they have their own clinical data that you are somehow that they're giving you access to? Where's the sort of data source? What's the state of play in kind of access to clinical data for payers?
Sure. So, we like to think that we will meet them where they're at. It's going to be different for every health system and every payer and every relationship that a payer might have with their health system. We like to make it a little bit easier for them from a technical point of view. So if they've got agreements that allows them to share clinical data, we want to reduce the burden that's required for them to be able to share that clinical data. In other cases, we might help broker some of those relationships as well.
I see. So, but give me a scale of, where they were 5 years ago to now. How are the payers doing in terms of caring about clinical data? Because it still seems to be a bit of a way. From a user experience, knowing payers, it still seems to be a bit of a way away
I think they're getting much more savvy about the importance of it. Where I think they're being driven to is how do you create that balance between their expertise in claims and their need for clinical data in order to fill in some of the gaps that they have. And I think they're getting much more savvy. Looking at it 5 years ago, we didn't even have standards to allow for that kind of interchange to happen, and look at it today. We now have standards. We have a lot of emphasis. We have even, at least with Explorys, we even have some stories that talk about the value of doing that.
Right, fantastic. All right, and quickly on Innovaccer, since early days, a ton of money's gone in. Give me a sense of play of how much is in, where is the company, employees, markets, roughly share between providers, others, in terms of client base. Just give me a sort of thumbnail for how you describe
we've got well north of 1,200 employees.
Yep.
We're doing very well from a capitalization point of view.
Do you remember what's the total that's gone in? Do you know off the top of your head?
I do not. I do not.
Your paycheck is cashing though.
That's right.
Well, that's good in these days,
That's right. That's exactly right. And in many ways, when you ask the question about the difference, or how many providers, how many payers, and all that, I would say the majority of our business remains. We're a provider-first company.
Yep.
The majority of our business remains provider, but there are adjacencies that have to happen with our health plans and payer customers, as well as with the adjacencies that might happen with life sciences or bringing discovery to the table, as well as diagnostic support and clinical decision support. So, vast majority is provider. We have a good amount of payer excitement and payer customers, and we have a lot of excitement around our work with the industry that is innovating around treatment and things of that sort.
Right. Now, you're the innovation guy at a startup technology company, and sometimes they say you have an innovation guy at those companies. That's a sign that they got too big and they're getting too standardized. But tell me, what is the next big thing that you think we're going to get out of, not necessarily Innovaccer, but as a whole, we're going to get out of this data analysis? What's actually going to move the needle on something in healthcare out of all this now data, AI, analysis, access to records? What's going to happen?
Well, it's funny because that question gets asked a lot of me. And I think that right now healthcare is at a very important inflection point. We have a massive workforce issue. We don't have the right people doing the right things quantitatively or even qualitatively. And at the same time, we have a fundamental problem with making sure that every American is getting the best care possible. And if you think about it globally, that everyone around the globe is getting the right care possible. So I think one of the most fundamental things that's going to change for us is when you start to use things like GPT or generative AI and the ability to start taking things that have been very complicated and making it a little bit easier. So we reduce the overall burden for clinicians. We make it a little bit easier for them to be able to do a much better job with some of the low-value work that they have, and let them focus and have them operate at the top of their license, whether you're a doctor or a care manager or a nurse. And I think so GPT and generative AI, I think is going to be huge. We have a project underway right now where we're going to be helping reduce some of the burden that nurses and doctors are under by using generative AI. I'm really excited about it. And I think the other thing that's going to have to happen is that we're going to, from an industry point of view, and an Innovaccer in particular, how do you take all the disparate data and disparate workflows and start to standardize things in a way that doesn't start to impact the personalized care that every patient deserves to have. So there's a lot of work being done where we are trying to figure out how to not let technology get in the way of having the right care being given to the right patient at the right time, in a way that's really fundamental to the insights that the data is telling us. Sometimes it's going to be AI, sometimes it's going to be advanced analytics, sometimes it's going to be common sense. And so there's a great deal of excitement around that. And I think the last thing that's going to happen is that as healthcare systems move closer and closer to value-based care, and much of their care shifts from fee-for-service, and health plans see that some of the reimbursement needs to move in that direction, how do health plans, providers, and other entities involved in that whole process, how do they create a trust factor that allows them to interoperate? And we like to think that a platform company like Innovaccer can be in that middle that creates that trust but verification of all that insight and data.
All right. Well, it's optimistic and optimistic view, and hopefully we're going to get there soon. I like the idea about getting common sense and dynamic in healthcare. I've been talking with Anil Jain. He's the Chief Innovation Officer at Innovaccer. Anil, thanks for your time.
Oh, well, thank you, Matt. Great.